Okay, here's a big conversation about mental health and homelessness that we need to have. In the last few years, LA has brought thousands of people into interim shelter sites. Some of the people who are moving indoors have mental health vulnerabilities that they need help addressing. Depression, anger management, memory issues. They're not intensive enough to actually qualify for care. Some people struggle in shelter and they end up back on the street. What we're creating is a system where the people who are the most vulnerable are maybe not getting the resources they need to stay indoors and to stay housed. Our office worked with a senior veteran who had mild dementia. One time he left the shelter for days. He didn't know how to find his way back there. And then he lost that bed, and it took so much work to get him back indoors. We need to do more to make sure that this situation is addressed. We need on-site services, either for someone who's in a moment of crisis or for someone who needs ongoing care. And we can provide that at our interim sites. Changes to Medi-Cal have actually made it easier for us to fund this kind of care. We can get reimbursements for part or sometimes all of the services that are being provided, and we can provide these services right in our interim housing sites. I've put forward legislation that actually makes this happen, that brings these street medicine teams regularly in our interim housing sites. That's the first step towards making this a reality for the city. Let's make it happen.